Dr. Trevor Hassell, please continue.
Thank you very much, Chairman. Let me say what an honor it is for me to speak to the issue of the impact of non-communicable diseases on CARICOM countries and the response they have generated, because these chronic diseases have significantly negatively impacted on the Caribbean over the past several decades, resulting in huge unconscionable levels of preventable disease, suffering, and premature death. This is associated with ever-increasing prevalence and severity of risk factors. 25% of Caribbean adults are obese. Prevalence of diabetes is over 10% in at least 4 countries, and 25% of adults are hypertensive. So it's a significant problem. These diseases in the region are resulting in a non-sustainable economic and fiscal impact, with, for example, diabetes and hypertension reducing GDP by some 3 to 8% in some Caribbean countries. Just to give you a flavor of specific responses, the response in the Caribbean to the NCDs has been one of high-level leadership from CARICOM governments and from civil society. But this leadership in collaboration with regional and extra-regional partners now needs to be enhanced. In the Caribbean, policies to improve quality and affordability of essential medicines for NCDs have improved. But again, these efforts need to be strengthened. The successes in these areas need to be evaluated to determine how best to strengthen and build on them. One of the recent and potentially significant responses to NCDs, which I'll share with you in some detail, is the formation of a Caribbean civil society network, the Healthy Caribbean Coalition. This was established to respond to chronic diseases and assist the development of health NGOs. Since this network has been formed, it has been playing a significant role in mobilizing civil society. For example, this coalition is presently engaged in a pan-Caribbean mobile phone text-based advocacy campaign in support of the high-level meeting. Early results indicate that the campaign has fostered conversations among the youth about NCDs and lifestyles. It provides a positive application for a popular method of communication among the youth, and is an instrument that has the potential to build capacity of the Healthy Caribbean Coalition and civil society. It's interesting that I'll share with you that in the few weeks of the campaign, nearly 80,000 mobile text messages of support have been received, and our Facebook page has gained 7,000 new fans. Additionally, there have been some 20,000 unique page views of the campaign. I'm a very practical person, and so I encourage you, each and every one of you, to visit www.facebook.com/get the message. Play your part. Be not just talking the talk, but as we say, walk the walk. Because as one of our Caribbean leaders said, if left to chance, all the gains achieved in the Caribbean during the march from poverty to relative affluence since independence can be wiped out by NCDs. Urgent, aggressive, community-based, whole-of-society approach is therefore needed to respond to the NCDs. I thank you.
Thank you, Dr. Hassell. Thank you. And thank you to the CARICOM nations who have been so instrumental in having this advanced as well.